Heart disease. Statistically, this is how you die. But heart disease is mostly preventable. The problem is, knowing how to protect yourself is confusing. The research seems to flip-flop every year, and clickbait headlines misrepresent the actual data. Your doctor is overwhelmed and might be using guidelines that are 20 years old. In this video, we'll walk through everything men in their 40s need to know about preventing heart disease, from how to spot the signs to what you can do about it. This video has been made available for informational and educational purposes only. HealthLoom does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of the video. This video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen. So what is heart disease? When people say heart disease, they are often referring to coronary artery disease. While there are other conditions like AFib or heart defects, this video focuses on coronary artery disease and other forms of ASCVD that affect the heart. ASCVD doesn't just happen in old age. It is a lifelong process that can begin in the womb. Pathology studies show that 50% of infants already have benign, fatty streaks in their arteries, the earliest precursors to the severe plaque blockages that can develop later in life. These blockages continue to develop over a lifetime. Atherogenic particles slowly build up plaques in your arteries. This can be a symptomless process, and sometimes the first sign of an issue is a heart attack. So how do I know if I have ASCVD? To estimate your risk, your doctor will likely use either the older 2013 ASCVD calculator or the new 2023 Prevent tool from the American Heart Association. Both use standard metrics like blood pressure, cholesterol, and smoking history to predict your risk of heart disease over the next 10 years. But while these calculators provide a helpful baseline, they have real blind spots. That's why it's crucial to understand the individual risk factors yourself. Blood pressure is the #1 predictor of cardiovascular disease, and the danger starts much earlier than people think. Once your top number, your systolic pressure, crosses 115, your risk starts climbing. If you are a man under 60, sitting in the 130s, your risk of heart disease has already doubled compared to someone at 115. After blood pressure, measuring your cholesterol is the next step. But not all numbers are created equal. The most actionable number on a standard test is your non-HDL, your total cholesterol minus your HDL. But the best test available today is ApoB. ApoB measures the protein attached to plaque-building particle in your blood. The National Lipid Association says you need to take action if your ApoB is above 90, and high-risk patients should push it under 70 or even 60. Lipoprotein A is another blood test that is missed by standard cholesterol panels. Unlike regular cholesterol, your LPA level is mostly locked in by your genetics. It doesn't change with diet or exercise, so you only need to test it once. 1 in 5 people have high levels. Having diabetes doubles your risk of cardiovascular disease. But even if you aren't diabetic, your HbA1c is still a crucial biomarker to watch. The moment your HbA1c crosses 5.5%, your risk starts climbing. So what can I do to reduce my risk of cardiovascular disease? In 2021, the American Heart Association released updated dietary guidelines for heart health. I've linked the full paper in the description, but here are the 3 most actionable takeaways you can start using today. First, reduce your salt. Lowering your sodium directly lowers your blood pressure, taking mechanical stress off your artery walls. Second, reduce saturated fat. Swapping butter and fatty meats for healthy oils lowers ApoB particles that cause plaque buildup. Third, cut sugar and simple carbs. Ditching refined carbohydrates directly lowers your HbA1c, and in turn, your cardiovascular disease risk. While diet matters, exercise is even more important. A UK Biobank study using wearable trackers divided participants into 4 activity levels. The most active group cut their heart disease risk by over 50% compared to the least active. Hitting that top tier takes about 50 minutes of high intensity or 900 minutes of moderate activity a week. Don't panic. That 900 minutes includes all your daily movement, like walking. While high-intensity training saves time, the real secret is consistency. Pick an activity routine you can stick with. But it's not all or nothing. Just going up one tier from the least active reduces your risk by over 30%. Sometimes lifestyle changes aren't enough to control cardiovascular risk. Fortunately, there are effective medications available. The lowest dose of rosuvastatin, a widely prescribed statin, cuts ApoB levels by an average of 33%. If that doesn't work for you, other statins, ezetimibe, and PCSK9 inhibitors can also lower ApoB. For blood pressure, a low-dose combination of perindopril and amlodipine can bring your systolic reading back under 130 in most cases. Lastly, GLP-1 agonists like semaglutide, Ozempic, improve blood sugar control. A low dose of 0.5 milligrams drops HbA1c by a full percentage point on average. That's it for today. Thanks for watching. This video is designed to be updated over time, so if you think we missed anything, or if there is a specific topic you want us to cover next, let us know in the comments. If you found this useful, please like and subscribe.